going forward, the idea of client-centered care and designing for the client experience is kind of in its early days. It's an evolving idea. So do you have some thoughts or suggestions on for health providers out there on how they should think about the idea of experience?
Look, I think I do. I think there's those of you out there that are in charge of purchasing decisions. And the realization is that the person that making those purchasing decisions is dictating the experience for both the health professional and the health outcomes for the consumer, for the patient. In the way those decisions often are made, they don't take into consideration what we're talking about. In order for the health provider to provide better health outcomes, he needs the right tools. And therefore, really understanding how they work and putting a list of criteria for selecting and evaluating some of these softwares is key. Otherwise, you in procurement are dictating a poor experience and poor outcomes. I think that decision, you shouldn't tread it lightly. For those of you on the other side, you said it best, Yianni. We often design for ourselves. We talk in absolutes. The user will do this, but we're often functional. The task can get done, but people trying to do this are struggling, and we never discover it because, again, the person that made the purchasing decision is not the person that's using it. And by the time we find out that there's a problem, they switch products. So it makes total sense. And I'm not talking about being fancy here. Let me be really clear. I think in health, there's plenty of opportunity of just being more than functional, being usable. Let's not worry about creating a delightful experience with flashy transitions and a good mobile experience. I'm just saying we need better health outcomes for patients. We need to better support health practitioners. Let's understand what they're trying to do. Let's understand the problem of health, and let's design software that is more than functional, that's achieving those health outcomes. And I think teams need to realize that that's important, and they need to have the right tools and frameworks for them to be able to have the right conversations internally and collaborate and have the learning lessons that it takes to deliver great experiences.
So that's kind of now part of, I guess, the design aspects of delivering an experience for a person. And I guess just to contextualize that a little bit, Ricardo, because we're sort of in the industry and we're sort of looking out and we apply these kinds of concepts around human-centered design and customer experience design and user experience design and user interface, and all of this sort of is interacting with humans. So understanding the human is kind of part of the starting point, isn't it? It's that level of empathy by being able to define who it is that you're designing for. So if you're thinking about sort of a mental health care practice or a physio or a dietitian or somebody who's wanting to think about the way that they're designing their healthcare service experience for their clients, what would you say would be some simple high-level things to consider?
I think, first of all, focus on there's so much to unpack on that. So let me stress that, hey, those of you in procurement that are making purchasing decisions, you've got a role to play here. You've got to have better practices. So something simple that you can do is talk to people and find out what are the tasks that those health practitioners do, those administrators do, and get them involved in the selection. Get someone that can help you do a bit of an expert review and compare things against each other, so you're more likely to make better purchasing decisions. And in essence, by you making better purchasing decisions, you'll put pressure on the software providers to lift their game. Let them know what you're doing. Have a better approach to selecting. Use expert usability principles to select them. For those of you on the delivery side of things, we talked about the humans, and I think a very simple thing that you can do is get an appreciation that you're supporting someone's work. And it's got to be, you're building a business. So supporting someone's work is simply that. They've got a bunch of tasks to do as part of their job. Your job as a software provider is to understand their work and the rules in that organization and design something that's helpful. And it's really that simple. I can give you a bit more theory around that, but if all you did was stop brainstorming new features, understand their work. How are you being helpful? What are the most frequent tasks that they're trying to do? How are they serving long-term health outcomes? How are you supporting them? What's their job? What's their job? What's their work? So I think that's the heart of it. And when we talk about human-centered design, it's about focusing on people. Well, yes, focus on the customer's customer or the patient, focus on the health professional, the administrator, the IT department. But what I find is that you've also got to focus on your team and how you make decisions and how you prioritize the time that you give to actually finding out how people work. More change can be done for the customer experience by focusing on the processes of how you deliver something and creating the space and support for more learning to occur. I think Agile has created a revolution in software delivery, but we're rushing towards a fictitious line. We're being very effective at delivering. What we're not doing is changing the outcomes for health. What we're not doing is lifting the dial for the business. And therefore, thinking about your delivery as a means of a learning experience and being iterative and being really clear on what matters to your customers in terms of the tasks you support. And within those tasks, what is it that they're after? What are they expecting? And getting the right processes to deliver is key. So I think for those of you on that side of that, the fence that are developing software, you really have to understand your own processes and change them. And 66% of digital initiatives fail. And they fail because they simply don't get feedback from the customer or user input. They fail because they're not managing the requirements appropriately to link back to that. They fail because management loses faith on the stuff that they're working on, and they throw all that work that you've been doing away. And if you think of it from a startup level, you've only got so much runway before your investors don't trust you. If you think about it from a large enterprise level, enterprise is also investing their money, and they could easily shift that funding to a program of work that's more likely to succeed. And therefore, this risk mitigation of talking to the user and being helpful is key.